Thank you for joining the June General Thoracic Surgery Database webinar. Again, thank you for joining. We hope you are all doing well and wanted to take this opportunity to thank you for all that you do. And again, thanks for joining today. On the call today, we have from the STS myself, Leanne Jones, Database Manager for the Thoracic and Congenital Databases. We have Carol Crone, Senior Clinical Manager for the STS National Databases, Emily Conrad, STS Senior Database Coordinator, and Jane Hahn, Associate Director of Quality. We also have our IQVIA colleagues, Melanie Bent, Jeanette Hanna, and team on the call as well. I'm going to run through the agenda real quick. We'll touch on a few housekeeping updates. I'll cover some important dates for the General Thoracic Surgery Database. Emily will provide you with an AQO update, and then we'll finish up with the IQVIA update. For our housekeeping items, the June training manual has been updated and posted. Just a friendly reminder also that the newly updated 2-for-1 data collection forms were posted to the website for your use. These updated forms, as well as the training manual, also do include both of the new COVID-19 variables, as well as some FAQs that have been submitted regarding these COVID-19 variables. The STS and General Thoracic Surgery Database Task Force are continuing to work on the 5.21 data version upgrade. We are currently finalizing the data collection form and preparing for beta testing by the core group. So at this time, we are still planning a go live of January 1st, 2021 for data version 5.21. Next, we have some important dates for General Thoracic that I just wanted to cover really quickly. As you're aware, right now we have the Thoracic Monthly Webinar today, June 10th. Coming up on June 24th, we do have our next General Thoracic User Group call scheduled for 2:30 p.m. Central Time. This summer, 2020, we're expecting to have the spring 2020 Harvest risk-adjusted results available. Again, that will cover procedures up through December 31st of 2019. And again, we are looking to have those available out this summer. On July 1, we have the General Thoracic Surgery Database web user interface direct data entry go live is set to be available. We'll have more information on that just on the next slide. September 18th, we have the Fall 2020 Harvest close date, and we are accepting procedures up through June 30th of 2020. For September the 30th, we have the AQO 2020 General Thoracic Surgery Database session, and we'll have more information on AQO coming up from Emily here in just a second. And then again, we have our January 1 date of 2021 for the version 5.21 go live. Next, I'm going to turn things over to Jane Hahn, the STS Associate Director of Quality, for an update and information on the direct data entry option that will be available with IQVIA. Jane?
Thanks, Leanne. Hi, everyone. Thank you for joining. Just so you know, we are actively developing and planning for an anticipated July 1st launch of the direct data entry option. Since planning is underway, we don't quite have educational materials and other resources developed to share with you at this time, but we did want to share some important points and be sure to let you know that we will provide additional updates via email blast when those updates are available. The direct data entry option will be available at no additional cost as long as a database participant is up to date on their participation fees to STS. You will not be required to sign a new participation agreement. And we realize that since the transition to a new kind of participation option may be a bit daunting for some and cause some confusion, we are assigning a team of STS staff members to provide direct assistance to all of those existing participants who are interested in transitioning from a vendor-based participation to the direct data entry option when that becomes available. Those who choose to transition to direct data entry will use the same login credentials to access the IQVIA platform. We'll also provide more information on this as the date approaches, but when it's pretty much a different role that we're assigning within the platform. So it'll be a seamless transition. You'll still use the same user credentials, and you'll just have different options show up for you in the platform. That's pretty much a difference between vendor-based and direct data entry. Again, we are in the process of planning and development, and we are working diligently on developing educational resources for you, and we hope to share those within the next week or so. But for now, if you are a participant who's currently in, obviously you're participating in the General Thoracic Database, if you're interested in transitioning to direct data entry option or to learn more information, please email us at the STSDB inbox at stsdb@sts.org. We'll be sure to add you to the list, and once we have more information available, we'll be sure to provide those updates accordingly. Thanks, Leanne.
Great. Thank you so much, Jane. We appreciate it. All righty. Next, I'm going to turn things over to Emily Conrad, the STS Senior Coordinator for the STS National Database for our AQO update. Emily?
Hi, everyone. I think you can go to the next slide. Perfect. This is Emily Conrad. AQO planning is underway. We've had 2 planning committee calls with the AQO General Thoracic Planning Committee. They've been going really well. We've discussed some tentative topics, and so I wanted to kind of share that with you. Right now, we're definitely going to be focusing on the version upgrade, so that'll be weaved in and out throughout, like when we're talking about lung cancer or esophageal cancer. Those 2 talks will definitely be in our live content. Some of these topics listed here will be pre-recorded, and you can listen to them later. For the live content, that will be an opportunity for you to be able to ask questions and get them answered. We will be having a What Data Managers Want to Know panel where you can have your questions answered as well. So that's all of our, you can see our topics here. And then as for registration and pricing, that's coming soon. We'll definitely be posting updates about that on our website, and we'll be sending an email as well to our probably all the data managers. Abstract submission is also coming within the month, so if you have a quality improvement project that you would like to submit, please do, and that'll be coming soon as well. Let's see, I think, the other thing I wanted to add is that if you have questions that you would like to be discussed at AQO, feel free to submit those to your clinical questions FAQ link that's out there on the website, so that we can be able to help you now. And then also, if it's a large enough issue that it will be discussed at AQO. So just use that existing clinical questions FAQ link that is out there. You can go to the next slide. If you also are going to be attending any of the other sessions, Intermax and PDMax will be on Tuesday, September 29th. General thoracic content will be on Wednesday, adult cardiac Thursday, and then congenital on Friday. And you can use this QR code here. If you scan it, it'll take you to the AQO page on our website. And for next year, we are planning to meet again in person, and it will be in Denver. So I'm looking forward to that. I've never been.
Yeah, thank you, Emily. Yeah, I've never been to Denver either, so I am definitely looking forward to that as well, and especially seeing everyone, hopefully. That'll be great.
Yeah.
Thank you so much, Emily. We appreciate it. All righty. Next thing we're going to do, I'm going to turn things over to Melanie Bent and Jeanette Hanna for our IQVIA update.
Thank you, Leanne, and hello everyone. This is Melanie, and I will kick us off with the IQVIA update, and then I'll hand over to my colleague Jeanette Hanna to review what's coming up in regards to a new report that we talked about previously. But in regards to what's coming up shortly, we have another IQVIA platform update. So that's a general update that will be applied. Nothing that is going to impact in regards to changes that you will visually natively see within the platform, but just as we call it, under the hood updates that we need to continue to do to improve as we move forward with just enhancements. In regards to new reporting, we do have the GTSD Harvest Summary Report. We discussed this previously, and Jeanette will be actually giving you a demo of that new report, but that will be released, and we are scheduled to have that available for users to be able to start using by next week. We do have a scheduled deployment that will be occurring this weekend that will include this new report. And once these updates are applied to the environment, we of course will update the notification sections. And just in case if I have vendors on the call, we also have implemented a updated distribution that we received from STS with all of our vendor contacts. So we will be sending out a email that will include these updates also, so that you all are also aware of these upcoming changes and what's been applied to the platform. Another report that will be coming in June, not during this weekend's deployment, is the DQR Critical Summary Report. And so this report is going to allow you to get a snapshot of all of the critical errors that have been encountered during your submissions in one report, rather than reviewing each individual submission. So that is a new report that will be coming towards the end of June. We do have another user group, I believe, call. I think, Leanne, that was like June the 24th, I think.
Yes, correct.
So we definitely will be covering that new report right before it's released, so that you all will, of course, have a demo of that and what will be available. And then, of course, we are working towards making sure that we're ready and opening up the direct data entry web UI feature functionality. That's coming in July. So again, more information to come, as Jane had indicated earlier. And again, I'm sure that the June 24th user group meeting will be jam-packed of information that we'll be able to provide. So definitely mark that one on your calendars if you haven't done so already. We will definitely have a lot of great updates to share then. Okay, and if we can go to the next slide, I believe this is wrapping up my section, and now I'll go ahead and hand over to Jeanette to walk us through the Harvest Summary Report. Jeanette?
Thanks, Melanie. This is Jeanette, just checking someone can hear me.
We can hear you.
Excellent, thank you.
Yes,
okay, so this is a just screenshot of the new Harvest Summary Report. And I'll just pause here for a moment before I take the ball and actually give you an interactive demo. So we have mentioned this in prior user group calls. This was created based on some feedback that we got from the user community after there was the change where each upload submission is really focusing the validation results in that data quality report on the records that had changed from a prior submission. So this report is designed to allow you to pick a range of surgery dates and to then get this summary report back, which will show you key information about all of the records that are in the STS data set and are eligible for inclusion in the Harvest with that surgery date range. So you can see in the pie on the left, we've got a summary of all the surgeries or all the records that were submitted, how many of them or what percentage have outstanding errors on them, which here is 23.6%, and how many of them have no validations outstanding, which in this example is the green wedge, that's 76.4%. The total list of records that are in this Harvest as it stands for this surgery date range for this report is listed in that box to the right, the alerts by submitted record. And then for details on all of those validations, we've got the record level validation down below. So with that orientation, I am going to try to take the ball and then show you my screen so that you can see the interactive piece. I'll just pause. If someone can confirm you can see my screen.
You can see.
Great.
Yes, yes, we see.
So
Thank you.
the new report will be available in the operational reports area, which is in the left navigation interface on the left. So you'll see it under this header of STS reports, and it'll show you this link for Harvest Summary Report. When you click on the link, you will get the option to enter your date range. This is your surgery date range, and I've already run it, and it just disappeared on me, so I'll run it again. So I've run it in this particular environment for just 2014 through 2020, just so you can see a sample of records that have different outstanding validation scenarios. So here you can see I've got all three of our options for what you might see for your status of your records. So certainly with some records in 2020 in this data set, I'm still working through some of my outstanding data entry items, and I've got some outstanding errors as well as warnings. This is a fake data set. It's just in a test environment. So this is not real data, and you'll notice some interesting stuff like the prefixes on our patient IDs are a little bit different than you usually see. Please don't be distracted by that. So in my submission summary here on the left, I have 9.5% of my overall records, and if I mouse over it, I can see the count. So that's 72 records that have no validations outstanding. So when I did my submission and I saw my data quality report, I may not have even really seen any validation messages appear about those because they just went in okay. There were no discrepancies. I didn't need to follow up on anything. They're all completely clean. So here we can see these have no validations outstanding. And then I've got a bigger portion of my data set, 83.9%, which is 638 records, where they have one or more outstanding errors. And if I click on this, then it will give me all of the details about the outstanding errors that are down here. And it will also show me for each of the records how many errors are there on each record and potentially how many warnings. So these records in this wedge of the pie, even though they have warnings on them, in the pie wedge, they would not be counted in the outstanding warnings section because it is about the most severe validation that is outstanding, and an error is a more important validation severity that I really need to take a look at and make sure that I've addressed these or that I'm comfortable with this being outstanding. The warnings are a lower severity, a slightly less urgent level of scrutiny. So you can focus your review on the errors first and then take a look at the warnings as you have time. So if I click and drag on this view, I can select my whole pie, and that will also select everything and include all of the warning detail as well in the section down below. You also always have the option, if you say wanted to get a list of what are all the record IDs that are included in my harvest for my participant, you can right click on this table and you have the option to export the table, and it will let you generate this into, and this is a CSV file, so you can open it in a spreadsheet editor or Excel if that's your preference. And you would have that list available to share with your colleagues or to work through what is the status of my records in the current harvest. So here you can see this is the list of patient IDs and record IDs that are included in my harvest for this facility with the date range of June 5th, 2014 to June 6th, 2020. And you can choose the date ranges that you're interested in focusing on. We also have the same types of filters that you have in the data quality report for GTSD. So if you wanted to focus on, say, only your major procedures or only the analyzed procedure types, then you can adjust the filters and you'll see that some of the criteria will shift within the report. It will dynamically update based on the selections. So I will pause here and see, Melanie, is there anything you wanted to add?
Sorry, I was on mute. And I think you've actually covered everything that I would have covered. So let's see if there's any further questions, of course, when we get to Q&A, but I think you covered everything.
Oh, one thing to add is because this is based on the surgery dates, so if you did 10 submissions last week, the status of what's showing in the Harvest Summary Report, it's going to be based on what's saved right now in the database for the records that are there to be included in the Harvest. So it's not looking back at that history of, you know, you had the same record and you maybe submitted it and then adjusted it and submitted it again. You can still see all that history in your data quality report, which is tied to each submission. But if you want a summary view of where am I at for my Harvest records or my Harvest eligible records right now, and I want to focus on a particular surgical date range, this is the report that you'll be able to use once it goes up this weekend. So I will pass it back to you, Leanne.
Great, thank you, Jeanette. Alrighty, can you see my screen?
Yep.
Yes.
Okay, all right. All right, so next we will move into, which everyone has seen these next few slides before, but just as a review, the STS IQVIA support plan. Again, this slide is posted out on the STS website as well as it's available, I believe, within the IQVIA platform as well. For questions regarding your data submissions, uploader data quality report, missing variable reports, you would contact IQVIA support via phone or via this email address. You'll be connected to IQVIA's Tier 1 support. Tier 1 support would be there to assist you and issue you a ticket number if necessary. If Tier 1 is unable to address your concerns, they would route you to either Tier 2 for support, or if it's an STS-related issue, they would route your question to STS directly. If STS is unable to answer, if your question is related to data analyses, if STS is unable to answer, we would reach out to DCRI for assistance. And for IQVIA Tier 2 support, if they're unable to resolve your questions, and if necessary, if it had to do with the software issue, Tier 2 would reach out to the database vendor to work directly with your database vendor. Our next slide, again, is just a list of STS resources that are available to you. We do have the STS National Database webpage. Should be your first go-to for any questions that you have. All of our resource documents are there, our contact information, webinar information, FAQs, Go Live checklist. Again, the tier level support document is out there. We also have our training videos, as well as a link to the IQVIA information. And also, here's the STS tech support at IQVIA.com email address. Again, for any questions related to the uploader, your data quality report, any Harvest-related questions, missing variable report, dashboard, password, and login. Also, here is the phone number for IQVIA support as well. Again, here is my contact information. If you have any questions, please feel free to reach out to me directly at any time. My direct email is ljones@sts.org, and my direct phone is 312-202-5822. If you have any database operational questions regarding contracts, payment issues, please reach out to us at stsdb@sts.org. Again, it's stsdb@sts.org. Before we get into our Q&A, just wanted to give the updates again for our next general thoracic webinars. So just be sure to mark your calendars for our next user group call, which will, as Mel alluded to earlier, will have a lot of information. It is scheduled for June 24th at 2:30 Central Time. And then our next monthly webinar for general thoracic is scheduled for July 8th at 1:30 p.m. Central Time. Next, we're actually going to just turn things over to our Q&A and get started with our questions. I see we've got a good amount of questions submitted, so we're just going to go ahead and hop into our questions. All right, Mel, team, you guys ready?
Ready.
Let's see here already. Our first question, hello, I'm wondering when we'll be able to get training on direct data submission? And I think Jane had alluded to that. We would be, we would have something available within the next week or two.
Yes, I think we're preparing some written educational documents, but there are plans to possibly schedule a webinar if the demand is there. So we'll be sure to provide updates as soon as we can. Planning is definitely underway.
Great, thank you, Jane. And Jane, I think the next one you had wanted to tackle as well. What is the email address surgeons can email to get IQVIA login information?
Sure, thanks, Leanne. I think this is a question that's been coming into the STSDB emails in higher volumes than normal, so I wanted to just make a general announcement regarding this. For the thoracic surgeons, so surgeons who are current participants in the general thoracic surgery database, everyone received their logins from STS Tech Support at IQVIA.com at the official launch, which took place in mid-February. If your surgeons are having difficulty finding their login information, we would encourage them to contact IQVIA Tech Support. I think the contact information was provided in a previous slide. If they continue to experience issues, please feel free to email stsdb@sts.org as well. We're happy to assist in any way we can.
Thank you, Jane. And I put the slide back up for the resource slide, so the STS Tech Support at IQVIA.com email address is listed there if anyone needs to reference that. All right, our next question, what will the fees be for AQO this year? I know, as Emily had alluded to earlier, we have not decided what the fees will be, but we are in discussion. I think, it's safe to say, STS realizes the constraints that everyone is having now, the institutions are having now with budgets. So we are working to make AQO a lot more budget friendly this year. So again, stay tuned for more information announcements to come out regarding the fees for AQO. I don't know, Emily, did you have anything you wanted to add, or Carol, regarding the AQO?
That sounds good to me, Leanne.
Yep, I think you covered it.
All right, great. Thank you. Our next question: if there's no extra fee for direct entry, what benefits will we have to stay with our current vendor? So, oh, go ahead, Carol.
No, go ahead, Leanne. Sorry, go ahead.
Oh, no, I was just going to say, with the direct data entry, you won't have as much customization as you currently have with your current vendor. I know with your current vendor, you can have your custom reports, all your custom fields, run your custom queries. I do know that will be one of the key differences between the direct data entry with IQVIA versus what your software vendor does offer. Carol, did you want to add anything to that?
No, I think you covered it. Maybe Jane, I don't think Jane, Jane, did you have anything to add? I think you got it, Leanne.
Nope, I agree. Thank you.
Yeah, thanks.
All right. All right, our next question. Will there be option of pulling the data directly from IQVIA if we go web-based direct data entry to IQVIA? We pulled several data from our current vendor-based data warehouse depending upon the need of physicians of various studies or in various quality projects. And IQVIA, did you all want to address that question?
This is Jeanette. I can take that one. So STS is aware of that as a need for the users. So, and Jane, correct me if I've got the wording wrong, but I believe the primary data manager contact would be able to pull the data directly, and it would be in a specific format that we'll provide. So it may not align with custom report formats that you may have gotten from a previous vendor, but it would allow for direct export of all of the data in the system. Jane, did you want to add anything?
Sure, thanks, Jeanette. I just wanted to clarify that we are adding 2 new roles that will be associated with the direct data entry participation option. There'll be primary direct data entry contact and backup direct data entry contact. And the reason why we did that is because we need a way to differentiate between a direct data entry participant versus a vendor-based participant. So when we're ready to begin transitioning folks over to the direct data entry option, we'll be sure to provide that in our educational materials. The backup direct data entry contact will not have the ability to download the data. It will only be available to the primary. So that's something to consider for participants as you just discuss internally and decide whether this is the appropriate option for you.
And also, can I
Great,
chime in? It's Melanie.
Oh, sure.
Just to add another flavor of the context, because I know that there were some discussions and questions last year at AQO. So when we talk about the direct data entry, it is the user going in and entering in, of course, the information via the application through a case form. It is not the capability of linking through like an API, for example, where there is a back-end feed that is then pushing the information into the application. That is not, I just wanted to call that out, that is not an option. It is something that has been raised, but that is not, just wanted to make sure that I'm clear on that because it did come up before and just wanted to add that context.
That's a great point, Melanie. Thank you for pointing that out. All right. Our next question, AQO sounds great, but there's definitely concern that hospitals will not have the finances to pay this type of registration when they're already furloughing employees. I realize this is not across the board, but it is a real concern. And Angie, we hear you, and STS, does understand, and we are taking that into consideration as our AQO planning committee does work to determine fees and everything like that for the AQO. So please know that we hear you and we understand so, and we are trying to work our best to make AQO as affordable as possible this year for everyone due to all of the current situation that we're all in. So we are working. Our next question, can we pull the customized data all the way from 2007 till now if we go web-based data entry in IQVIA system?
This is Jeanette. I can take part of that one. So the new platform does not currently have all of the surgeries going all the way back to 2007. So that is not the current data set that would be available. We are looking at having an option to add participant-specific custom data fields or custom fields if you wanted to include that in your records that are newly created. And you could go back and add that information on existing records that have previously been submitted from your vendor files, but the vendor submission format does not currently include all of those participant-specific fields, so they would not be available in the STS data set at the time of transition to the web interface. So that is one area where there would be a gap in the data set as part of a transition from a vendor. Melanie, did you want to add anything?
Those are the main points also that I would have covered.
Great. Thank you, Jeanette. Thank you, Melanie. Our next question, will vendors need to make any changes to the existing Harvest file configuration based on IQVIA updates? Yes.
This is Dr. Wormuth. I just wanted to just provide a brief clarification. So IQVIA has all of the data, but unless it's the current version or the version before, it's not really available on the web platform. I just wanted to clarify that. So that's why we have the 2007 data, but we can't surface it to a site. I don't want someone to think we didn't have their data. We have it, but it's just not viewable in the current configuration.
And that is correct.
Perfect.
So, yep, thank you for calling that out.
Yes, thank you, Dr. Wormuth. We appreciate it. All right. Our next question, will vendors need to make any changes to the existing harvest file configuration based on IQVIA updates that are scheduled to release to production this weekend?
And I can take it.
I don't believe that's the case.
That is not the case. There
Go
are
ahead.
no changes that would, we are not requiring any changes from vendors in regards to the update that's happening this weekend.
Perfect. Thank you, Melanie. Our next question, does this actually only show the files that are eligible for evaluation? We would love to have a way to know which files are the ones that are TAVR and won't be actually evaluated. So
I assume that question is in regards to the Harvest Summary Report that was demonstrated earlier.
Actually, Jeanette, this is Carol, and this is actually an adult cardiac question. TAVR cases are excluded. We don't do, they would be in the other category. So I guess you can answer the first part of the question, but what Beth is referring to is actually an adult cardiac question regarding transcatheter aortic valve surgery.
So for the Harvest Summary Report, it would include all records that had been submitted and successfully made it into the STS General Thoracic Database for the selected surgery date range. So it would not include only those that are eligible for evaluation. It would include everything. And then for the GTSD view of the report, there is that filter for the major and minor procedure. And I don't know, Leanne, if you could go back to that slide just to show the Harvest Summary view again. There were the filters on the left for analyzed and non-analyzed, and I believe major and minor procedures. So you can focus in on that based on the filter selection to look at the general thoracic data more specifically.
All right, thank you, Jeanette. Our next question, will we ever be able to accept the outstanding errors? In real life, just about all records will have errors per your site, but they are not errors.
I can take this one. This is Melanie. So the errors, if they're not addressed, they will continue to persist. So at this point, there is no option of being able to, I guess, maybe an override to go ahead and just suppress that. That is not available. So those errors will continue to persist.
Great. Thank you, Melanie. I appreciate it. Our next question from Nancy. In the submission summary, where is the full volume of records displayed? Warnings plus errors plus validations.
So in this view, the pie will represent the full volume of records, as will the alerts by submitted records table on the right, which is scrollable, and you can scroll down to see the full set of records. So that will show for all of those records, did they have any errors, any warnings, or were they ones with no validations outstanding? That entire list will show in both of the top two sections. And then the sections down the bottom, the record level validation, that will only show the details on the errors or the warnings.
Thanks, Jeanette. Our next question, does Data Harvest look at different version changes when populating submission summary results?
This is a great question. So this is Jeanette. So the errors and warnings that are appropriate to each version will automatically be in place. So if this view, this Harvest Summary Report would include all versions applicable for the surgical date range selected.
Perfect. Thank you, Jeanette. All right, we have one more question. So if you all have additional questions, please feel free to go ahead and get those into the Q&A. Our next question that we have, if you go to the IQVIA Direct Data Entry platform and terminate your vendor, can sites download, export all of the historical data, or are there limitations as to what timeframes or versions sites can download?
This is Jeanette. I assume this is in reference to the question about exporting the data.
Mm-hmm.
If they had a vendor and then go to the web data entry system and then are asking if they can export the data again.
Yeah,
so
that's what it sounds like.
We did 2 versions for general thoracic. So Melanie, please help me. What are the date ranges available for that?
So I believe we have 2.31, which is that 7/1/2014?
2015.
2015?
Yep. 2015.
I'm going off my memory here.
1/1/2015 is the start of
there we
version
go.
2.3.
Okay. So it would be.
And for this particular case, what I would recommend if you're going to, I mean, there's a very good chance that you have data older than this, but actually in any case, if you terminate your contract with your vendor, I would, regardless of what you're doing, whether you're going to the platform or not, I would get an export of all your data from your vendor software before you terminate that contract.
I think they're supposed to do, the vendors are supposed to provide that, correct, Paul? That's
Yeah.
part of their,
Yes, well, the vendor software should allow you to export all of your data, including your custom fields. So
Right.
you should be able to get that data in some format.
Yeah, that's part of our software specifications for the vendors build. Good information.
Thank you, Paul.
You're welcome.
Yes, great information. Thank you, guys. Our next question that we have from Claudette, is it possible to display the date ranges within the actual Harvest Summary Report, in addition to seeing the dates displayed when clicking on the ellipses for the Harvest Summary window?
Yes, and this is Melanie.
The date.
Yeah.
Okay, go ahead, Melanie.
Yeah, and this actually was something that we got a ping on in regards to being able to make sure that we show that date range on the screen. We do for now, so for the initial, when you go in next week and you start to review it, you will have to use an option, and if I can just quickly show you, since we have some time, but we will, what we can do is display the selected date range on the left-hand side of this screenshot that you're showing underneath the filters, so that you can quickly see the reporting date range that you entered. But there is a way that you're able to actually view that information when you're in the report. So let me just quickly show you that.
And just to clarify, which Melanie is about to show, this is a really great suggestion. So thank you, Claudette, for the feedback. And we will look at making this adjustment in a future update.
Okay, and I'm going to share my screen in just one moment.
Yep, you're fine, Mel.
Okay, let's go here. And just let me know if you can see my screen.
Not yet.
Oh, let's try it one more time. Here we go. Share.
Okay, there you go. It's coming up.
I don't think I have anything for doing. Let me just put in the date through today.
There you go. We can see your screen now.
All right, perfect. And hopefully I have some data in there. But what I want, I put in 2020. I don't have 2020. But what I wanted to show, so once this populates, there is this option here where it says expand and then it goes to collapse, you are able to visually see that date range here. Let me just put this so I can at least have some data pull in. Okay. And it does hide once you hit apply. It does hide. But what we can do in a future release is to make sure that we include just that information here underneath this panel where you have your filters, where you can actually see that and reference it quickly. But what you're able to do to quickly see, well, what date range do I currently have selected, and you are able to select that, and you will be able to see that, and of course make the change if you wanted to shift to another surgery date range. Okay, so just wanted to show that and where potentially would be showing there for you.
Awesome.
All right, I'll stop sharing here.
Thank you, Melanie. Okay. Our next question from Nancy is, what is the denominator of the Harvest report?
So it's the total number of cases or surgical records available for the selected date range. So this percentage, 23.6%, this is a total count of the number of records at this participant for the selected date range.
Excellent. Thank you, Jeanette. I don't have any more questions. I'll hold just a few more moments to give anyone the opportunity to get another question submitted. While we're waiting, I'm just going to put the screen back up just to cover just a reminder. Our next general thoracic user group call is scheduled for June 24th at 2:30 Central Time. And then our next monthly webinar is scheduled for July 8th at 1:30 Central. I'm still not seeing any questions. I don't know, Carol, our team, does anyone have anything they'd like to add or anything regarding any updates before we end the call? Looks like we actually have about 10 more minutes left, so we may just end a little early. But does anyone have anything else they'd like to add?
This is Carol Leanne, thanks. The only thing I wanted to add is that we had an email question come in that said the web page the date was incorrect on the web page for the user group call. It had marketing just corrected it. The next user group call is correct on Leanne's screen here. It's the 24th at 2:30 p.m. Central. So just to clear up any confusion, and I apologize for that. So it is the 24th at 2:30.
Oh, great. Thank you so much. Thank you for letting us know. We appreciate that. All right. Actually, I have one more question that just came in. It says, why do I not receive the total number of records back after I submit a file? I think maybe, Denise, are you talking about, Melanie, I think it's the total records that she may be referring to.
Okay, she may be referring to in regards to the change when she's doing subsequent submissions. So there was a change, maybe about, we're in 2 months now, possibly. So there was a change in the uploader workflow and how those records were being processed. And so when you do submissions now, and if those records were already in the database, and if there are no validations, active validations available on those records, there were no changes because the record was not updated, it's not a new record, those records are not, the validations are not firing on those records because it is recognized as being as an existing record in the database. So you will see only the total count of records that were considered as either being new or updated. And so that's the count that currently shows on the submission card, that upload history card. So now you will receive the option to use this report to be able to see a holistic view of what is currently outstanding in regards to those error validations or warnings. But that's the functionality that you're seeing now, that if there are no changes to those records, it is not counting those. You can see the total count if you open the DQR. and you look at the very first entry that appears in the alerts by upload section, you would see that it's indicated as record 0. You will see the total count of the records that have been identified as being unchanged in that cell. And then any records that have been updated or added, you will see those individual entries listed within that same section. So you're basically seeing the change in workflow due to that change in the program that was done for the uploader.
Great. Thank you, Melanie. And also, we did cover those in the last 2 webinars. So if you need a refresher on how to or just a visual on what Melanie was just talking about, if you go out and check out, I believe it was last month's webinar or user group call, Melanie does cover that in in those calls, so in those recordings. So that is a reference out there for you if you need a visual on that as well. We have 2 more questions. Let's see here. Is there an ETA for when the filters will be updated to allow us to drill down to look at just our lung cancer or esophageal cancer cases?
Katie, we're probably going to need to get back to you on that. I do not remember immediately at this moment, so I just need to get back with the team. And I'm like vaguely remembering it, but let me just follow up with the team and we can reach back out to you to give you more context on that, okay?
That sounds good. Thanks, Melanie. Thank you, Katie. And we have 1 more question. It says, thanks for adding date ranges as an enhancement to the Harvest Summary Report. May we also get the Harvest Summary date range values added to any exported report information as well?
Yes, so once we add that, and we've had this on previous reports, so once that field is added in regards to the reporting date range, when you're exporting, that also is pulled onto that export, so it would be available.
Great. Thank you, Melanie. Thank you, Claudette, for the question. All right, so that's all that I have for questions right now. Again, on the screen, I'm just sharing my contact information. If you have any questions or any concerns, please feel free to reach out to me directly. I'm always available. My email is ljones@sts.org, and my direct phone is 312-202-5822. I'm happy to assist in any questions or any concerns that you may have. I'm here to talk to you. So with that, still don't have any other additional questions, so I guess we'll wrap a little early. Thank you, everyone, for joining today. We greatly appreciate it. We hope you all have a great week, and we will see you on our user group call that is scheduled for June 24th at 2:30 p.m. Central Time. Thanks, everyone from STS IQVIA. Thanks, team, for helping out today. I appreciate it. And we'll see you all on the 24th. Thank you so much. I hope you all have a great week.
Thanks,
Thank you.
Thanks, Leanne. Thanks, all.